Okay, well, I'm showing 12 o'clock straight up. So I think we're going to go ahead and begin so we can start on time. Hopefully we'll end on time. I'm going to try to be as disciplined as possible, get through the content, but also be mindful of everybody's time investment. Again, welcome to the Advantage Health Plans Trust 2020 annual member meeting. Again, we appreciate everybody attending remotely in lieu of our in-person event. Of course, this event is being recorded. So if there's anybody within the bank that would like to view this content, we will be providing a link to the presentation in its entirety. We like to get together about this time every year to go over how the plan is performed, things that are working well, also talk about challenges. And that's what we're going to try to do today with you all. Sure. Hope we can get through this without too many technical difficulties, but you never know in these kind of environments. I'm Jay Kempton. I'm the plan administrator for Advantage Health Plans Trustees. Advantage Health Plans Trust. I work for a group of 7 wonderful trustee bankers that are elected by you, the banker members of Advantage Health Plans Trust. And my co-presenter here is Melissa Nance, so I'll let her introduce herself.
Thank you. So Melissa Nance, I'm the Chief Brand Officer, also here at the Kempton Company. My responsibilities as I've been at Kempton over the last couple of years, or actually 7 years.
7, yeah. Been here.
It's the lucky 7. My responsibilities have changed. I started out at Kempton being the sales rep, director of business development in Texas, and bringing on and building the business there and raising awareness there. Took on a promotion and moved to the vice president and oversaw the sales and marketing team and the department for both Oklahoma and Texas when our friend David Weaver, who you all know, retired after being with the company for 32 years, I think. And then last year, took another promotion to the Chief Brand Officer, and so now my responsibilities include overseeing not just the sales and marketing department, which I still am highly involved in, but also the account management team. And you're going to hear a lot about some of the things that we've been involved in over the last year and some enhancements and improvements that we've been implementing. But during my time over the last year, I also relocated to Oklahoma. And so as of last week, I'm still not ready to say I'm no longer a Texan. I'm still just saying I'm a Texan living in Oklahoma for now. I've been here for a year, so.
We live with that.
We'll take it.
Definitely.
That's where we're at.
And before we begin, thank you, Melissa. Before we begin, you know, as if COVID-19 and all the other traumatic things that are going on in our country were not enough, and in the banking industry, at least one of our Advantage Health Plans Trust bank family members at First State Bank of Three Rivers, Texas, also had to deal with Hurricane Laura a few weeks ago. And so we just wanted to recognize those folks. They actually had a few employees that had some pretty good damage to their homes. As we understand it, nobody was injured, which is a blessing. We're glad to hear that. And we're just thankful that everybody's okay. So, you know, remember the folks over at First State Bank, Three Rivers, Texas. When we think we've got it rough, we at least don't have to deal with a hurricane. So I'm glad you guys hung in there and hope things are getting back to normal. So our agenda today is going to cover quite a few topics, but we've already done introductions, so you know we're on a roll. Plan milestones, we're going to talk about those. We're also going to talk about some program and some service enhancements, that some steps that we've taken to not only improve the program, but also improve and expand on some of the service options. Member outreach, communicating with the member banks and your employee and dependents. Then also reporting and performance. Again, what's working, what's not working, what are some of the challenges within the health plan that we work with you all to try to address things that maybe some significant cost drivers where we need to enlist some assistance from the bankers on. We're going to talk about everybody's favorite subject, COVID-19, but actually right after that, everybody's really favorite subject is secretly, I know this is why most of you all attend, is that we will present the 2021 renewal numbers. And then we actually have some exciting news that Melissa's going to share about some a whole new AHPT. It really has to do with engagement in branding and education. So we'll talk about that. We also have a new customer support structure here at the Kempton Company that is specific to Advantage Health Plans Trust. There's also some plan changes. The vast majority of them are positive, really positive. Some benefit enhancements with an eye towards being a better consumer. And then also finally, some technology enhancements. Advantage Health Plans Trust would not be what it is, nor would it be where it is today if it was not for the elected representatives of the member banks. These are your elected AHPT Board of Trustees. We have Paul Freeman is the chairman of the trust. Paul's bank is in Texoma. We have Jim Dilley, is a banker in Sapulpa, Oklahoma. He's the vice chairman of the trust. We also have Priscilla Cude from First Bank in Bethany, here in Bethany, Oklahoma, right suburb of Oklahoma City. Also Sandy Werner, First National Bank and Trust of Elk City in Elk City, Oklahoma. We have actually 3 new trustees. We've had a couple of retirements. We had a bank that actually sold and was no longer on AHP, and so then we had a trustee that just rolled off the board because of term limits. But we're proud to welcome 3 new Advantage Health Plans trustees. We have Casey Barrett from Texas State Bank in San Angelo. Welcome, Casey. We also have Joey Root from First Liberty Bank here in Oklahoma City. Scott Long from First National Bank of Sterling City in the great city of Sterling City, Texas. And we have 2 advisory trustees. These 2 trustees are really great assets. They're not full voting trustees, but when their schedule lightens up and hopefully we can talk them into moving into the chairs, they'll be great additions to the board, but they do attend every board meeting. Doug Fuller is an advisory trustee from Quail Creek Bank here in Oklahoma City, and then Evans McBride is also an advisory trustee from First National Bank and Trust of McAllister in McAllister, Oklahoma. Thank you all, trustees, for your service.
So I've been delighted to serve with the trustees over the last 7 years of my time at Advantage Health Plans, and I've also seen a lot of evolution in the trust. And so some of that evolution has come with some milestones that Advantage Health Plans has achieved, and a couple of those milestones happened just in the last I would say a couple of months. It's now September, so occurred within the last year or so. So we wanted to take an opportunity to celebrate these planned milestones. I like to use the word celebrate, but also announce these milestones to you all, the membership. As everybody I think knows, and we announced at the user group meeting last year, Maria Robles Myers, who was the trust counsel that had represented the trust for multiple decades, passed away unexpectedly, and definitely left a gap that needed to be filled. And so the trustees, as well as the plan administrator, went through a process of due diligence, trying to identify a trust counsel that could fill that gap. So we feel very confident, as do the trustees, that we have accomplished that goal. And so new trust counsel Corey Cook with CMC Consulting, also known as Fiduciary Risk Management. Sometimes you might see the acronyms FRM, has joined as the official trust counsel, and the trustees have asked her to serve in that role. So we welcome Corey, and she serves with a team of individuals that we at the administrator depend a lot on. The trustees also depend a lot on. She's also accessible to the member banks. And so typically during this meeting annually, you all would also hear a legal update. As you know, Maria historically provided that legal update during this format. Corey and her team have gone through a significant due diligence review, and they will actually be providing a separate legal update in another forum, which we'll actually talk about at the conclusion of this meeting, and make sure you all have the information to join that as well. That'll happen.
Get your calendar marked.
Yeah, so we welcome Corey. She's been a great asset. We depend a lot on her, and we appreciate her counsel, as do the trustees. Secondly, we have achieved a milestone, one that has been a long time coming for me, and one that I have been very passionate about, and I know that a lot of the Texas bankers have also been very passionate about. So the trust governance document actually used to, before it was amended, actually used to allow for 6 seats for trustees to represent the trust, make plan decisions, etc. When Advantage Health Plans Trust moved into Texas, which has probably been 15 years ago at this point, the trust document was amended to allow for an additional seat to represent the Texas bankers as well. And within that trust document, it also allowed for the growth. So as Texas membership grew, what would also occur is that additional seats for trustees that represented the Texas bankers would also grow. The milestone that needed to actually be hit in order for an additional Texas trustee to be added to the board was 1,000 lives. So interestingly, the trust actually hit that milestone for a brief period of time at the end of 2019, and then has met and sustained that growth since January 2020. So Texas has now hit and exceeded, as you can see, the 1,000 life milestone. So you know, that makes me very proud, obviously, because I'm a Texan.
Oh, yeah.
And so I just
makes
wanted
me proud because I'm in Oklahoma.
So I just want to thank all of the, the Texas bankers that have put their trust in Advantage Health Plans and in us to provide employee benefits and health plan for your employees at your bank. And also thank the Oklahoma bankers and the Oklahoma trustees who have supported that growth and that improvement over the last 15 years or so. The third milestone that we actually hit, though, that was also that is also celebratory, is that at the same time, sort of on a parallel path that we were achieving the goal of growth in Texas, the trustees also made a decision to amend the plan document and allow for representation on the board for any membership, regardless of whether it was Oklahoma or Texas. So in other words, or New Mexico. So in other words, the limitation that provided for a number of seats represented in Texas based on the number of lives that the trust grew to, that limitation was actually removed. And so as you saw on the previous slide in the introduction of the trustees, you can actually see the fruits of that labor and the result of that change and that trust document amendment, because we now actually have 2 trustees in Texas serving on the board. So those were big milestones that the trust has had a long time coming. We're all very proud of that and appreciate the support that everybody that contributed in that milestone.
Absolutely, absolutely. With the changes in the community banking industry, Advantage Health Plans tries to be as big tent as it possibly can be, and we welcome community bankers in any of the states that we that we operate in, and you know, in the future we may end up going into other states as well as the industry contracts, try to serve as many community bankers as possible. So,
Yep.
thank you, Melissa.
So let's talk about some additional program and service enhancements. If you are identified as somebody at your bank or in your employer organization who is part of either the executive committee, the benefits committee, the day-to-day contact person, we typically try to send out updates as these updates happen throughout the year. I always like to give a reminder to everybody, though, that if you work with an IT team that protects your interests very well, those emails might be getting blocked from some of your filters. So I like to give a reminder during this meeting for everyone to check the settings on their email filters and work with their IT team to make sure that any emails that are coming from an email address at the Kempton group, that those would be safe so that you also can get these announcements throughout the year. But we've achieved some enhancements that we also want to report to you. As you all know, the KPP free program is sort of our signature program. It's sort of our signature benefit. It happens to be the benefit that achieves the most amount of savings from the plan perspective, but also I think is probably the most positively perceived from an employee and dependent perspective. And the reason for that, as you know, is that the KPP free program allows for employees and their dependents to have an enhanced benefit if they choose to utilize providers who we have direct contracted with through that program. Those providers have chosen to offer upfront bundled cash pricing, and that pricing is very reasonable, and it makes a lot of sense for the trust, the health plan to be able to enhance the benefits for that. So employees that utilize that get to receive essentially a free benefit, which is where the name for the program comes from. So we actually have enhanced that program. We actually had we have about 2 to 3 full-time staff who are now dedicated to efforts of improving that program, doing the account management and relationship management with our providers, as well as going out and identifying new providers to participate. So in 2020, we've actually grown that program by 13 or 14 additional providers. And that, I mean, we view that just continues to give us more and more opportunities. And I will tell you for everybody listening that some of the way that that program growth occurs is very organically. Oftentimes it is started by the employee sometimes who is having a conversation with their medical provider and talking about what's important to them in their medical choices and in their benefit choices. So oftentimes that conversation happens very organically, just even down at the employee level. And then oftentimes those conversations are driven by the local employer in that local community. And so in addition to the enhancement of adding the additional providers, I do want to remind everybody, you know, these conversations can be had, and we also have support to, you know, deploy our own provider relations employees so that they can also support those conversations as well. But that's a big growth. I think overall now we're at, what's our total number of providers? Over
about 150 now.
150 providers. So
and some of them have hundreds of locations, like on the radiology.
Yeah, no doubt. So lots of locations. We focus primarily in the Texas, New Mexico, Oklahoma areas. You will see, and in the information that we're providing in our packets, you will see some other KPP free providers in other states. That's as a result in most cases of having those nationwide locations, but that's a big celebration for us. Also, number 2 on the list, we've actually added 19 new direct RBP agreements. So what is RBP? You all remember us talking a lot about reference-based pricing and using some reference that makes sense to the 2 parties that are contracting. And in the case of these agreements, the reference that makes sense to the 2 parties that are contracting is some derivative of Medicare. So typically how those contracts are structured is that whatever that provider that we're contracting with would typically get paid by Medicare, we usually take that number as a starting point. That's a number that those providers accept every day, all day from their Medicare participants on their reimbursements. So we usually start there, and then we add some percentage to that. Y'all are familiar with that type of arrangement because that's also the type of arrangement that any out-of-network providers get reimbursed in the absence of a PPO network. So we have been trying to build the number of providers that are in acceptance of those types of agreements, that agree to the allowables at that percentage of Medicare, and also choose to not balance bill participants. So it's a win-win-win for everybody. We view that sort of as where a lot of the future is going to be with Advantage Health plans and with the plan designs that we're looking at. So we're proud that there's almost 20 new of those agreements, and it seems like those are starting to happen almost as quickly and as often as the KPP-free agreements.
Yeah, and it's also very encouraging that actually happened in 2020. Because of COVID-19, it's been very, very difficult, more difficult than normal to actually get an audience with some of the decision makers in these facilities. So it's definitely good momentum.
Yeah, that's a good point. So third on the list, we are launching a mobile app for KPP Free. So we are always sort of looking to you all and taking feedback from our members, your employees, their dependents on how best for them to be able to navigate through the various benefit selections, the various programs, the various contact options that they have with us. And so part of the feedback that we've received, which I think is probably not unlike most industries, is that having the app for that is valued by everybody. And so we have been working on the build out for our KPP Free mobile app for a year or better, and it's ready to launch. So we're going to talk about that a little bit in this meeting, and then you'll also be receiving some additional information in the coming months leading into your open enrollment period. Also, I wanted to tell you that we've added some new team members to our staff here at Kempton that have clinical and medical expertise. We have got, let's see, 2 LPNs and 1 RN. So we've got an RN in our provider relations department. So having somebody with that clinical knowledge and that expertise is very helpful in the negotiations that we have with providers. It really helps us have a better seat at the table, and she brings a lot of expertise to those conversations. So Amanda Cole is our RN in provider relations. She's also, incidentally, provides us some support here in the office as well, and provides some support to the customer service Kempton Care Advocates to have sort of an overlay or oversight if they have any questions that they need answered.
She's been a wonderful resource.
We view that as a big asset. We also have a customer service rep that in sort of what the words are that we use within Kempton is Kempton Care Advocates. Her name is Bree, and she is an LPN. So she's somebody that is in our call center on the phones daily, assisting your employees and their dependents with those redirections to the Kempton Premier providers through the KPP Free program. And then we've got another full-time LPN who 100% of what she does is seeking out opportunities for redirections. Her name is Tracy Krieger. Your employees may hear from her. Oftentimes we sort of get made aware through the reporting and the looks that we do on the claims and analyzing diagnosis and working with our case management vendor and those types of things. She's sort of behind the scenes. I like to call it that she's digging for opportunities. Yes. And so we're looking for opportunities to make outbound outreaches to the employees to see if there's an opportunity for redirection. So we're proud that she's come on the team, and we've been working with her for several months now. And then finally, we're going to talk later in the presentation about our new client support structure and some additional member-facing technology. So lots of enhancements. We've got all positive things in my view for us to report this meeting. So you all may recognize Garrett Voss and Brad Bronner. displayed there on your team. Both joined us recently, or, I guess since we've been in COVID world, it's not recent anymore. The months and the calendar just sort of tend to continue to pass without us even realizing it. But we heard you. So our focus over the last year has really been placing a heavy emphasis on member outreach and, having somebody in your bank or on the, at the end of a telephone call, especially during COVID, to assist you with walking through any of the changes that have been announced, or explaining benefits, or helping your members, or, giving education meetings.
Being a hands-on resource that you have a relationship with in your bank.
Yeah, just being that person. And I say that person, I know that at least one person on the call gets the Grey's Anatomy reference whenever I say we want to be that person. It is our goal to provide that concierge level of service for you. So over the last year, we've placed a heavy focus on a couple of different things. Our hope was to connect with you. There's been a lot of change, and we talked about Maria earlier. We talked about David Weaver earlier. There's been some other, retirements within Kempton. One of the things that you all know about us is that a lot of the staff that have been here at Kempton, you've known for a long time because they've been here for a long time. But in the last couple of years, there have been some changes. And so our goal was to reach out and connect with you. We wanted to make sure that you knew who Brad and Garrett were and what their roles were. We wanted to have them to encourage you to have ongoing education and to place a focus and an emphasis on the cost containment education that is occurring in your bank on an ongoing basis. We wanted to also give you a little bit of a handhold. We know that there are some employer responsibilities that you're responsible for carrying out in the benefits administration of this health plan within your organization. And so we wanted you to have a resource to sort of interpret those things. If there are any compliance issues that we've had to announce, we also wanted you to have someone to talk those things over with and sort of recap them. Although we send those typically electronically through the email, we also wanted to make sure that you knew that there was also someone available to talk through that. And then also just have somebody to sort of walk you through what's going to happen next. So, COVID happened, and there were some questions about how that was going to impact us and how that would impact the plan, but also just sort of talk you through what the next steps were from now until the end of the year, getting through this rate adjustment process and open enrollment and that type of thing. So that was our goal. I will tell you, again, with my role and with my commitment to what I know that Kempton stands for, that's also our expectation. So I do want to sort of put it out there for all of the membership that we hope you're feeling that, but I would encourage you, reach out to me personally. My contact information is provided. I want to hear that that's working for you, and I would love to have that feedback that you have seen.
Or if it's
that
not
outreach.
working, you want to hear too.
I want to hear it if it's not working, and Brad and Garrett are listening, so they'll also be the recipients of hearing that as well. But that has been our goal, that is our focus, and we wanted to sort of reiterate that to you, that that's the case.
Yeah, back to what you mentioned, Melissa, about a few new faces and some folks retiring. I don't think we need to explain generational change to our community bank customers out there, because I know a lot of you are dealing with that in your banks as well. And so yeah, so that is certainly happening here at Kempton. I was actually on a video conference with a fellow employee, and in the background on this employee's computer screen was an intern here at Kempton that happens to be my daughter, and I'm still not used to that. So generational change is certainly afoot in most industries these days, especially in the community banking area. So reporting and performance, Melissa and her team tried to do everything that they can to make Advantage Health Plans be easy to use and not too heavy a burden on the employer. But at the end of the day, Advantage Health Plan, we've talked about this in these user group meetings before, it is a partially self-insured plan. If your bank, if your HR team, or if you all are familiar with kind of the duties and responsibilities of a plan sponsor that has their own self-funded plan, where they are responsible solely for the payment of their claims. They're not part of a trust like Advantage Health Plans. There's significantly more responsibility, and one of the big responsibilities is if the plan is not performing well and costs are going through the roof, that becomes a management topic almost immediately at that employer. With Advantage Health Plans, you all have hired an administrator to take a lot of that burden off, but it still is important, and many times we have to outreach and engage with the member banks, which is you all, to tell you, hey, this is a problem. We're seeing a lot of expense here. We're seeing a need for more aggressive management here. Well, unfortunately, I think you've heard I think I've said this before in meetings, in the healthcare space, there are no more silver bullets. There's a limited amount of things that can be done, and we're doing, I think, all of them as far as direct contracting and negotiation with medical providers, and trying to provide carrots where appropriate. When an employee makes a high value medical choice, then we either eliminate or greatly reduce their out of pocket. But with all that being done, there still is a need for the member banks to have an awareness of where are some of the challenge areas. And honestly, there's also a need for us to be shoulder to shoulder with you all within your bank, within the capacity that you're able to help target some of the educational things that we talked about here at these user group meetings. So with all that being said, we'll go through some of the performance and reporting. You all really have kind of the Bible of the reporting, and we are not going to go through all of the reporting that you all have in your packet, which is, I'm sure you all will perceive that as a good thing. I was just texted, I'm not being rude, I'm actually getting some messaging from some of our team members. Don't forget to say this, but the slides, these slides that we're looking at right now, and all of the handouts that have all of the plan performance metrics are already on the AHP website. But within those are plan performance metrics, which we are going to go over. There's also going to be some communications about the Kempton Direct Access Provider enrollment. That is where we have been integrating within Advantage Health Plans Trust the ability to have a direct primary care relationship with a DPC or direct primary care physician. That program, there's no cost to it. You automatically have it. We call that a direct access provider within Advantage Health Plans, and several of our banks that have direct primary care physicians in their area have already availed themselves of that. So there's some of that in the packet. Also, all of the KPP free providers, the entire list, not just the ones that were added in 2020, are in your packet, along with all of the direct contracted providers that have the direct reference-based pricing agreements in place with no balance billing risk whatsoever with those providers. Kind of an association of the good guys is what we like to call it, because we don't like to ever be accused that we're trying to rebuild another PPO network. This is trying to find providers that are fair, but also are very high quality, and then try to give them as much business as possible, because we want them to be the competitive benchmark for other medical providers. And then also healthcare blue book metrics are also in your packet. Some of the things that we're going to talk about, though, are some of the KPP reporting. We've got a contrast here between 2019 and 2020. The 2019 numbers that are on the left, those are for the entire year of 2019. 2020 is only through June 30. So when we compare, I also want you to keep that in mind. We're only dealing with with 7 months. But the other thing is, COVID happened, really in the middle of March. And, Oklahoma and Texas, shortly thereafter, they became prohibition on voluntary and elective medical procedures that just couldn't be done. A lot of the KPP procedures, even if they're, fairly heavy duty procedures like, joint replacements, cardiac care, et cetera, they're essentially non-emergency type procedures are really kind of KPP's sweet spot. And so it's really impacted quite a few of our numbers. As you can see, the number of just gross procedures of advanced health plans, 820 so far in 2020, 2,600 in all of 2019. So even if we double the number of procedures to take into account the last 6 months of 2020, we're still not close to where we would be on a kind of a normal, whatever that means these days, normal year. You can see some of the different parameters there, but we also want to draw your attention to the average saved numbers. We do know that our utilization of the voluntary procedures is down, so the net savings is down. But if we start looking at it, the savings on an average KPP claim, the savings is actually better than it was in all of 19 on an average basis. So the effectiveness of KPP on a procedure by procedure basis is better than it's been really. I mean, I don't know that we've had an average that high since inception. And I think not only is banker awareness a part of that, but we're adding more KPPs that offer more expensive procedures, which is a great thing. You were going to say something.
I was going to add to that's also a little bit of a story that tells kind of about what's happening outside of KPP, which
Right.
is the comparison there is also increasing.
Exactly.
So in other words, the effectiveness of KPP is better because the rest of the world that's non-KPP just continues to increase. And so we're doing a better job of containing that.
Yeah, and that's a great point. Within KPP, I think I could probably list on both hands the number of procedures that have actually increased in price in 10 years. So it's, don't get me started, my cynical nature starts to kick in, but we hear about medical trend. It doesn't seem to affect our KPPs like it does the non-KPPs. So,
Sure.
But anyway, cash price agreements significantly down, and that's where the patients are actually taking that active negotiation into their own hands and are out there essentially having a conversation with their medical provider. Hey, I have this KPP benefit available to me. I'd like to have my procedure with you though, and you're not a premier provider, but if you will match this price, then my self-funded benefit plan will waive my deductible and co-insurance. So that happened over 100 times last year. So far this year, it's only happened 4 times. Melissa and I were discussing that before. Not only is it an indication of a reduction in voluntary and elective procedures, but I can tell you from my time spent with our provider relations team here at Kempton that it is very, very difficult to get a hold of somebody at a medical provider's office that has the authority to talk about pricing right now in COVID. In fact, a lot of those folks that were in managed care or contract negotiation in some of these hospitals, they were the ones that got laid off. So the person you need to talk to doesn't even exist. And so that's been a problem as well on the cash price agreements, because those generally do require somebody with authority to sign off on them at the provider level.
I would say don't let that deter you though. This is sort of our rally cry. What's happening out there in the provider community certainly we try not to let it influence how we educate and how we encourage participants whenever they need to have these conversations. And so we believe that the market dynamic can sort of ramp that back up again. And we want everyone to continue having those conversations. And we know that when we've seen the employee who is ready, willing, and able to have that conversation. We're there to support them. And the louder our voice is, the more response we get from the providers.
And the interesting thing also that we've noticed is that once an employee does a cash price agreement and they start to feel that empowerment, everything that they get done, they want to do a cash price agreement.
From that point on.
Yeah, we have really some frequent flyers. And what we've been told is that they feel empowered. They feel like they have the ability to have those kind of conversations with their medical provider. And honestly, if us Americans were doing more of that, I don't think healthcare would be the mess that it is now. Market share would be rewarded to the providers that were able to address the price and quality question aggressively.
Sure, yeah.
So the savings report on the previous slide obviously is the good news story. The missed opportunities, though, we also keep a good track on those. They're a lot less than they were before from versus last year. Really, though, for the same reasons. We only had 186 missed opportunities, and that's simply because there was not the ability to have a lot of those voluntary and elective procedures done, whether you did them at a Kempton Premier provider or whether you did them outside at a regular network provider. So anyway, this is we've always provided this slide. I don't know how meaningful it is necessarily. We did have the largest missed opportunity this year was so far is 55,000, which is a lot better than last year. We had it was really an unfortunate deal where we had a voluntary procedure that the member just didn't see a whole lot of difference, had met their out-of-pocket, had met their deductible, just didn't see much of a difference between using a KPP or not using a KPP, and the pricing differential. I think that procedure was somewhere in the $60,000 range, I think, if done in a KPP, and yeah, so
yeah.
Those are hard to see, but it is what it is. If it was easy, everybody would be doing it. Okay, so the reporting on the reference-based pricing. Anytime that you hear on advanced health plans where we talk about or you see the name of a plan option that has choice in the name, that's your signal to understand that is a plan or a benefit option under advanced health plans that does not have a PPO network. The member can use any medical provider that they want to, but the plan is going to limit its maximum benefit payable to a percentage above that medical provider's Medicare. This, in general, I can't remember all of them off the top of my head, but I'll give you the two main ones. Like on a physician visit, we pay whatever that medical provider would normally accept by Medicare, plus an additional 30%. If it's a hospital procedure, it is whatever that hospital regularly accepts for a Medicare patient, plus an additional 60%. And there's also a little bit of negotiation window within that. That's how the program works. Again, there's not a network. We do have quite a few direct contracted providers, though, that if you if you're concerned about the potential for the medical provider not accepting that payment as adequate, then we would encourage you to either use a premier provider or to utilize one of our direct contracted providers. But outside of any of the direct contracted, this is kind of how things have shaken out from 1/1 of 2019 through April of 2020. We've had 18,000 total claims that have been processed through a choice plan. About 4,300 covered individuals that have had claims through a choice plan. Of those 18,000 claims, we've had 22 balance bills. Of that, it's actually 0.12% of the 18,000 total claims. Of the 22, we had 10 positive resolutions in which the balance bills were able to be negotiated away. The average negotiated settlement on those that was 240% of Medicare. And I think, we mentioned this last year, most of the time when we get a balance bill, it's in just a handful of categories usually. Those categories are generally anything that's emergent, ambulance rides, life flight helicopters, and then the other one is anesthesia. The thing that all of those have in common is the patient doesn't get to choose, generally speaking. You don't get to choose what helicopter service comes and picks you up, just like you don't get to choose who's going to be your anesthesiologist when you're having a medical procedure. And those providers know that, and they can kind of charge whatever. It's kind of the Wild West out there. So those are the ones that are most difficult. But even with all of that, as you see, there's still a small, less than 1% of the actual total claims are resulting in a balanced bill. Really the tale of the tape for the bankers out there, of those 18,000 claims that were processed under a choice plan, that represents a total amount of bill charges of $20,200,000. The plan allowable at the default Medicare Plus levels that we were just talking about, the plan allowable is 7.3 million. Drastic reduction. And again, these medical providers, Medicare they set their reimbursements at a level in which all but the smallest rural facilities are actually profitable at Medicare. It is not as easy for a rural hospital to be profitable at Medicare, so there is certainly, I think, a degree of cost shifting is certainly warranted. But the larger metropolitan-based hospitals, their target is always to be profitable at Medicare. So any percentage above is generally gravy that just drops to the bottom line. So you see that reduction from the 20 million in bill, 7.3 million was allowed, resulted in a plan savings to the trust of almost $13 million for those choice plans. Melissa's going to talk a little bit later. We are still encouraging banks to at least consider a choice plan. We actually are, when we add new member banks to Advantage Health Plans, we're actually seeing a lot of those that are just electing full. That's the only plan they're offering is a choice type of plan.
And there's a cost differential there too, right? There's a cost
on the contribution side.
Yeah, there's a cost differential between the contribution, the premium contribution for one of those PPO plans that's a non-choice plan in comparison to one of the choice plans. So there's a benefit there really for everybody, and you can see why when you look at the amount of savings that those plans achieve. I will just mention before we move on to the next slide, we did not plan for a ton of time to talk about it in this presentation, but there is support both on a pre-service basis as well as on a post-service basis to assist the employee with navigating the tough conversation with the provider, and then also support in the event, and it's an unlikely event, but in the event that a balance bill occurs, there is support. So, you know, Brad and Garrett, as they come out and talk with you this year, they will definitely be placing a heavy emphasis on educating about the reference-based pricing, those choice plans, and the benefits and the value that comes with them.
You know, not to toot our own horn here, but I was just thinking, and we have done a couple of webinars this year by themselves regarding reference-based pricing. Might be something that they're out there on the YouTube channel, but might be something that we send out a little reminder on.
It's a good idea.
And it's one of them is more suitable for HR or management, and then the other one is more suitable to a member or to an employee. Okay, so everybody's least favorite topic here.
It's also the elephant in the room.
Yeah, it certainly is. As you see, Melissa and I.
Mine's hidden.
Yeah, we spend a fair amount of time around each other. So I think if she's got it, I've got it. If I've got it, she's got it. But walking through the office is certainly just like the bank. Everybody is masked up. But COVID-19, I did a webinar in regards to COVID-19 back in the early time. I think it was in April, if I'm remembering correctly. And, well, you know, everybody was, what is it going to do to my health plan? What is it going to do to costs, et cetera? And how is it going to affect things? And I think everybody was wrong, which is what kind of expected. I was hopeful that what I was saying was going to be truthful. It was truthful based on everything that we had read back in April, but boy, a lot of things have changed. COVID-19 has had an impact on your plan. I think it will continue to have an impact on your plan. The things that we're talking about here on this slide are what we are going to refer to as the direct impacts of COVID-19. As you can see on the heat map, that's where we have seen the COVID-19 claims, whether they be actual treatment and or testing. Those are the areas in which we have seen COVID-19 be active. COVID-19 antibody testing, we've done so far 231 antibody tests. The average amount paid for those antibody tests are about $52. That totals about $11,000 plan paid. That is also paid at 100%. There's no deductible, there's no co-insurance. That's a federal mandate, so that's a uniform across all plans. About 141 employees and 65 dependents represent those 231 tests. Diagnostic testing, so antibody testing for those of y'all that have not been following this as close as some of us, antibody testing is where you get a test not because you have symptoms, but because you think you may have been exposed and got over COVID-19 and you're wanting to know whether or not, was that horrible cold I had 3 weeks ago, was that COVID? And so that's what you get an antibody test for. The diagnostic testing is you're actually experiencing symptoms and you need to know, is this COVID? Is the bank going to let me come back to work? And many employers, just like us here at the Kempton Group, we require testing of employees before they can come back to the work premises. That represents 1,225 claims for diagnostic testing. The average price of that test to your plan is $85.61. That's also paid at 100%. That's we've had about 102,000 so far just for the diagnostic testing. 662 employees, 361 dependents. The treatment details, we've had 91 confirmed cases of COVID. I can tell you, here at the Kempton Group, we've got about 55 employees, and we've, I think, had two. They both, thank goodness, came out of it relatively unscathed. One of them a little thinner, I noticed on the video camera, but certainly not fun. So of that, about 78,000 in confirmed treatment costs. And I think that's a little bit of a misnomer. I know that, here at Kempton, Advanced Health Plans is one of our very important clients, but we also do self-funded administration for other non-bank employers. And I can tell you just anecdotally that we do have one employer in Oklahoma that had a participant that came down with COVID, and this patient actually passed away. And the cost of that hospitalization, that inpatient hospitalization, again, it was one of those horrible ones that ended in a fatality, but the cost of the plan was $700,000. So that's got the actuary a little nervous, got our trustees a little nervous, got me nervous. Corey Cook, Advanced Health Plans counsel, she actually hangs her hat in Wisconsin. She had a client of hers in the northern part of the U.S. that actually had a $10 million COVID claim. Of course, there is stop loss reinsurance that would protect Advanced Health Plans from any sort of a claim like that. But those are killers out there. You're certainly going to feel that. You're definitely going to feel it if your reinsurer has to pay out that kind of a claim. You're going to have a big increase there. So those are the things that have got us a little bit nervous. I think we've been fairly fortunate. Of COVID suspected, so these are going to be folks that have respiratory problems, have other symptoms, but they did not have a confirmed case of COVID-19. So this could be a bad flu. honestly. But we've had almost 600 of those. We just did not have it. The diagnosis did not come in with the COVID code attached to the claim, but there is actually an ICD-10 diagnosis code that is suspected COVID, and 193,000 paid there. Anyway, so the total direct impact to Advanced Health Plans so far has been 384,000. But believe it or not, that's not the area that has been the most impactful. The most impactful part of COVID have been the indirect impacts. The indirect impacts of COVID really have to do, and if you've been watching the news as much as probably anybody can stand these days to watch the news, you will have certainly heard or read that as fewer and fewer patients were going to the hospital and seeking, as the hospitals refer to it, those high profitability voluntary and elective medical procedures, as those plummeted, as you can see on that all claims paid graph there on the left, you can see what April looked like in 2019 as far as dollars paid out in claims versus 2020. As the utilization and basically the business for a hospital went way down, we are now seeing that they are increasing their charges really across the board to make up for the loss of volume that they had earlier in the year. That's the thing that we're concerned about, because we all know that's creating kind of an increase across the board in healthcare costs. But I can assure you, if COVID ended tomorrow, we would not see those charges now somehow then roll back. It's always a one-way gate. Once it goes up, it's not going to come back down. So that's the thing that we're probably more concerned with, and we're seeing that self-funded, fully insured across the board. It's really kind of the talk of the actuarial community. The middle chart there is actually Advanced Health Plans COVID-19 activity, which is graphed the claims over a time period, number of claims, and for testing and or treatment. Obviously, the spike for Advanced Health Plans was really in mid-July. The right graph is all claims volume, so this is not just COVID. This is all claims volume. Volume of claims, not cost of claims, but we just wanted to show you all 2019 is the dashed line, and you can see it's kind of an up or down, it kind of vacillates up and down month after month. 2020, there was just a huge reduction. Basically, the bottom fell out as far as volume in April, and it's certainly rebounding now.
Before we move on from that topic, I do want to say that we felt it was important to talk about COVID and the impact. And so sometimes that conversation can come across a little clinical and cold and callous. But we also recognize and want to state it out loud that we do realize that the individuals behind the COVID diagnosis and suspected diagnosis and treatment and all of those things are actually employees and their families within your communities and in your organization. So like in our organization. So we do recognize that, and we certainly send our thoughts out to you all for that purpose. But we did feel like it was important to talk about it in this presentation.
Yeah, I agree. Thank you for bringing that up. You can kind of get lost in the numbers, but yeah, the human side of COVID has been tremendous, especially for our elderly population. So thank you for reminding us of that. So 2021 renewal, as you know, with the risk categories, the renewal is at the trust level. Each individual bank will get their own rate adjustment depending on whether or not you are more healthy or or less healthy than the average member bank out there. But when the actuaries look at what they see going on today and then what they anticipate happening tomorrow, they make a recommendation to your board of trustees of where do they think, are the contributions that are coming in from the member banks into the trust, are they adequate to pay the claims that we've experienced in 2020? Yes or no? And if they are they adequate to then pay claims for the next 2021? Because as you know, we're making a decision now that's going to have to carry us through the end of 2021. So when all that has been taken into consideration, the trust level increase for 2021 is 10.6. Again, COVID was one factor there. The other factor is we're seeing other claims continue to move up, and we've got some charts indicating that. Just some of the trends that we've seen from 2017 to 2021, just to keep everybody's perspective here. As business owners and HR folks, and we look at this and say, what happened last year? What happened the year before that? What has our overall trend been? And over the past 5 years, Advantage Health Plans has enjoyed an average increase of 5.4% over 5 years. As our actuary says, that beats most of the plans that they have been engaged with through the years. We've had some great runs in 2017 at 5, as you see in 2018 it was 1.5, in 2019 it was a 0. But really 2019 is when we started to see medical claims moving up, but prescription claims probably more aggressively moving up. And that's the thing we're going to talk about here in a minute. 2020 was a 9.8 and 2021 is a 10.6. The renewal metrics, you can see 73% of the member banks this year for 2021 will get that trust level increase. 27% of the member banks will actually get a higher than the trust level increase. With COVID looming out there and some of the additional uncertainty that we are feeling, I'll just go ahead and address it. The board looked at and actually took a recommendation from the Trust Council and also from the Trust Actuary that 2021 is probably not the year to give rate decreases. And as you all will know, from the years past, probably the smallest piece of the pie is actually a decrease because the group has become less risky than they were the year before. The board, again, took the recommendation of the actuary and the Trust Council, and this is based on what they're seeing across the board, that it probably just would not be a prudent decision to give out rate decreases. We want to try to keep our powder dry, to use kind of a euphemism. And so there won't be any decreases, and that was really to keep the overall increase for the majority of the banks as reasonable as possible, while also keeping the trust physically strong for the future.
So looking at the rest of the products, some of which are also self-funded, others are fully insured that we offer at Advantage Health Plans. If you're currently offering the dental plan, that plan is getting a rate adjustment to 1.74% increase. I was interested to know that the dental plan actually has not undergone a rate adjustment or a renewal increase since 2017. So, when we're looking at the rate increases and when the trustees are taking recommendations from the actuaries, the dental plan is actually included in that. And so since 2017, that hasn't had to have a rate adjustment. The other,
and I think it's a good point just to add there is, the dental plan, as Melissa said, is self-insured, and so it pays its claims out of the trust fund, just like the medical plan, just like the prescription benefits. And so the trust has always instructed the actuary that, we don't want to be subsidizing the dental plan with our medical plan. Likewise, we don't want the dental plan to necessarily be subsidizing the health plan. We want that the dental plan benefits they manage really to a break even. That's just kind of a good thing to always keep in mind there. Advantage Health Plans is a nonprofit trust, but the dental plan is almost like a dollar exchange. I mean, it's just dollars in, dollars out.
Yeah, that's a good point. Thanks for saying that. So the other plans that are listed there on your screen are Vision Plan and then are also Unum benefits. You all might recall from last year that our Vision Plan, which is offered through VSP, is currently in what we call a rate guarantee, which means we won't undergo a rate increase for this year. And so the rates for 2020 will remain the same for 2021. And then we also offer a package of various products with Unum. We've got a basic life and AD&D insurance, which is offered at the group level. It's paid for if you elect to offer it at the bank level. It's paid for by the bank. There's a variety of different ways that you can structure that, whether it be at a multiple of salary for each individual within your organization, or whether it be just a flat amount, like a flat $15,000 or $20,000 amount. If you're offering that within your bank, that also received what we call a rate pass, which means the rates will not change for 2021 from what they are currently in 2020. And then as well, we offer a voluntary life and AD&D product that can be paired with that basic life product. The voluntary product is actually coverage that is over and above what the employer might choose to offer for their employees. That can be elected at a voluntary level by each individual employee for not only themselves, but also for their spouse or their children. And there's kind of a variety of different packages that you can put together there, but that is age-based. So depending on the age of the individual who is elected to purchase the product, that would determine what the rates are, but that is also receiving a rate pass this year. If you're not offering any of those products, I would also just say that from an administrative perspective, we try to make it as easy as humanly possible. So we do what we call consolidated billing, collection, and remittance on those products. And so we also want to give you some encouragement to talk with Brad and Garrett both about those and maybe what you're currently doing. And if you're interested in maybe changing that up, we'd definitely be willing to talk to you about that and interested in doing so this year. But I think that's a pretty positive renewal on the ancillary. We call them ancillary products on the ancillary products this year as well.
Yep.
Okay, so I'm just going to do a quick time check. And maybe before we go into, can we check to see if there's any questions?
Sure, let's do that real quick. Let's see if I can.
In the widget, if there are any questions, we ought to be able to see them here.
We'll start right. Get rid of these old ones here. Here we go.
Okay, so there are a couple of questions. Let's address them as they come in, and then we'll also make sure and follow up if there's any that need to be followed up on after. So first question is, will this be available in a replay link? The answer to that is yes. We are actually recording this session. Although we've got very high attendance, which we're very proud of, we do also want to be able to provide this to everybody after the fact. So if there was somebody in your organization that was not able to attend, you have this. Typically, we usually place these recorded links out on our YouTube channel, and then we will circulate that link once that is available for public use. So it usually takes us a week or so to get it and put some finishing touches on it. Since we're 100% remote this year, that might be faster.
It might be.
So look for that in the next couple of weeks, and those will be posted on our webpage, as well as we will send out an email to everybody so that you can access it that way. The next question is, thanks for the concerns after the hurricane. All is well. Thank you for telling us that. We had been in contact with Brad, and I knew that Brad had been in contact with you all. So thank you for that update. Will we get a copy of the slides? Absolutely. The slides and the packet will be circulated as well with the link. So thank you for asking that, and we'll definitely make sure that you all get those. And then when should the renewals be expected? Thank you for asking that. So our timeline, we are kind of going to go over through the end of the year. But our, it's funny when you think back historically, this meeting, we didn't even used to talk about renewals.
No, hadn't been decided yet.
Hadn't been decided yet at this point. So a lot of the trustees and a lot of the member banks will recall that the meeting for the trustees to determine the renewal didn't actually occur until the end of October. So we were all, like you all are, in a little bit of a panic trying to get that information. And those usually came out in November. With the change of our timeline annually, we're able to get those out a lot quicker. So our plan is that every member bank should be receiving a phone call from Brad and or Garrett, depending on where you're at, Texas, Oklahoma, or New Mexico, within the next week. Our hope is to kind of give everybody a heads up of what your actual bank increase or rate change is going to look like. So those will be happening verbally in the next week. And then we expect the letters to actually print and go out in the mail after that. So our timeline for doing that is we'll say mid-September that everybody should have renewals in hand. Another couple of questions, and then we'll go on to the next part of the presentation. Are the Kempton Premier providers a separate benefit from the Blue Book benefit? Do you have to use a KPP-free facility to receive the Blue Book benefit? Great question. Thank you for asking that. I think that is a common question that a lot of people ask, and the short answer to that question is it is a separate benefit. It's a separate program, but the longer answer to that question is that you can double dip. And the reason I say
in conjunction with each other,
they work together. The reason I say that is because, and briefly, I'll just talk a little bit about Healthcare Blue Book. Healthcare Blue Book is a resource or a tool that we use that every member of Advantage Health Plans has access to, either through the desktop, which you can access that by logging on to your portal as a member through AdvantageHealthPlans.com, or you can also download the Healthcare Blue Book app from the App Store. And so every member has access to the tool, and the purpose of the tool is to be able to search for medical services or procedures, either by keyword or even by CPT code. If you happen to have orders that a doctor has given you that shows a CPT code on it, you can search for that medical procedure or that medical service, and Healthcare Blue Book will display for you a range of cost of what that typical medical procedure, what you could expect the cost to be in your local community based on the zip code from where you're searching. So Healthcare Blue Book displays that range and then also indexes that range of cost for those medical procedures to a fair cost. But the reason that those benefits work together, or that those programs work together, is that we have actually incorporated any of the Kempton Premier provider or KPP-free providers that we have contracted through the KPP-free program. We've incorporated those into Healthcare Blue Book. So for anybody that utilizes Healthcare Blue Book to search for and to become price aware and use that tool as an educational resource, if that procedure is eligible for a KPP-free benefit, then that would display through the tool as well. And one of the actual plan changes that we're going to talk about, or plan enhancements, I guess I should say, for 2021 that we're going to talk about is actually some additional enhancements and improvements to that Healthcare Blue Book Green Rewards program. So they do work together. They're not the same program. There's definitely virtues to both. And that's one of my favorite things to educate on. So we'll definitely take a note and make sure that Brad and Garrett in their education are doing that as well.
Yep.
And then the next question there is, will we also be contacting the brokers? And thank you, Summer, for that question. We absolutely will be in contact with you to make sure that you have the information as well.
Yep. Regarding
the renewal. Okay, thank you all for those questions. So let's move on to a whole new AHP. You know, the trustees expect that whenever we at the Kempton Company, whenever we are marketing and providing information and education, both on the sales side, but also on the account side, on the client side, for our customers, when we're providing that information, we're doing it always with an eye towards ownership and helping the member banks who are considering adopting Advantage Health plans, and also helping the member banks who've already adopted Advantage Health plans to keep that eye towards this plan being a self-funded benefit plan and the ownership that being on it entails. So we actually started an engagement at the direction of the trustees about a year or so ago with a company called Insight Creative Group. And they are a marketing firm, and their stated goal was to assist us and the trustees with sort of refreshing our message to ensure that the message was simple, easy to understand, fresh visually, and it was engaging, and it made sense to the membership. And our sole focus of that engagement was to help improve that the message that we actually come away from conversations with is toward that eye of, you know, cost containment and ownership for the plan. So we engaged Insight Creative Group, and one of the things that was actually a happy outcome of that engagement was that we actually got a new logo out of the deal. And so we unveiled the logo for Advantage Health Plans Trust at the trustees meeting a month or so ago. And so I want to take some time to go through that, to show you all what that looks like, and what it means to us, what it also means to the trustees, and how we hope to be, you know, sharing that message with you all.
And of course, we were very nervous when we rolled it out to the trustees, because this was a departure of probably 25-year-old look and feel, and so we didn't know how these bankers were going to react to moving their cheese and changing the branding, but I think it was universally heralded as a great move. So it was really good to hear.
Well received.
Yes.
So in the coming months, you'll be seeing some updated communications materials. You'll see throughout the rest of this presentation that we will feature the new brand and the new logo. But here's a peek behind the scenes into some of the features and the symbolism of the new logo. First, there's a monogram. The monogram is the A. It is practical and straightforward. It begins with the stylized letter A, signifying Advantage Health Plans Trust. Secondly, there's the curved crossbar. It's upward curved, which juxtaposes the dynamism and energy with an otherwise stable and equilateral triangle. In addition to providing energy, a curved crossbar symbolizes the protection that the plan affords to both the individual members of the trust and also the collective. The angled bars, the four angled bars that form the base of the logo, suggest a successful graph. That could be more growth, more members, more stability, or I think our personal favorite, more savings. And finally, the gradient. In the four angled bars, the colors transition from green, the color of growth and money, to blue, the color of calm and stability.
Yes. And after going through that, I know a few community bankers that would say, well, that's awfully flowery, Melissa, but that is the thought process that went through with some of the designers in regards to this. But it certainly was not just about a new logo. At the beginning of the slide, there is this fresh and modern visual style. The modern, I think, is something that we all also want to pay attention to, because I know the banks are going through, again, generational changes. And you got to figure out, I've sat through enough sessions with experts in the community banking space at conventions where, you know, bankers like, how do we connect with these millennials? How do we bank millennials? How do we bank that I mean, you know what the generation is after millennials, but those guys and gals. Advanced Health Plans has not really changed its messaging. I'm just talking about a logo, but how we communicate to the bankers. Bankers are changing, and so that was really also part of this engagement. So, thank you, Melissa, for sharing that. So, are you ready for the big reveal?
The big reveal. This is a project that has been very near and dear to my heart, for sure. Because my hope is always that we are portraying the right message, both in the sales and account management department, and doing the trust and the trustees justice. So having a logo that means something and that aligns with that message has been very important to me, and I've been privileged to be involved in the evolution of it. Okay, so let's now talk a little bit about what you're going to see from us in our service to you all. It's always been our goal to provide service that exceeds your expectations. It's always been our goal to separate ourselves apart from the rest of the market. And we hear frequently from our employers that, you know, calling someone on an 800 number where you don't know who's on the other end of the line and that person is just reading from a script is just not something that you value. In stark contrast to that, being able to speak to someone that you know, that lives and resides in your community, that understands the plight of the community banker, and that is really part of the industry, is something that you do value. So one of the engagements that we've been working on over the last year is to implement some improvements to that end. You are the focus. Your satisfaction is our responsibility. And so we have created what we are calling a new structure, a customer dedicated team, and we lovingly refer to it around our office as the pod. The pod focuses on the team experience. It focuses on communication and collaboration. We expect, as a result of these changes, and we are already seeing the fruits of this happening, that the folks that you all talk to on the other end of the line are more specialized in their understanding of the plans that you offer. And so we've essentially segmented the office here at the Kempton Company to provide a group of individuals at Kempton that support you all at the membership of Advantage Health Plans.
And that's all. I mean, that is a dedicated team, really from the folks that build the plans and program the claim system all the way through the folks that handle the billing and admin, on through to the folks that help with problem resolution, and the Kempton Care Advocates will be a dedicated team just for Advantage Health Plans.
Yeah, and we've divided our organization into those pods, and those pods consist of anybody from, an account manager or a sales rep, which, as you all know, is either Brad or Garrett, all the way to the Kempton Care Advocate, our finance team, the plan bill team, some of the folks that you all might not even hear from or talk to or see on a regular basis. But the contrast to that is that historically, if you were in finance, you were in finance. If you were in a plan bill department or a claims department or an admin department, you were in those departments. So our goal with this structure has been to form a team of individuals that is a well-oiled machine to be able to provide the services to Advantage Health Plans. And we've seen a lot of benefits from doing that so far. So this is a dedicated customer dedicated service model. It facilitates a greater sense of ownership and accountability, and it makes the company functions more transparent, encouraging the team members to work together to achieve the same goals. So we have empowered those teams, and the thing that we've been saying a lot lately is instead of asking the question, what's the next thing to do? Ask what's the right thing to do. What when a employee, one of your employees or one of their dependents contacts someone within the Kempton company, we want to ask ourselves, what's the right thing to do for that individual? And then we want that collective customer dedicated team, or the pod as we call them, to work together to solve that problem. What we don't want is for questions or creative solutions to get buried in the process. And so having that team of individuals collectively right there together, not only metaphorically together because they're part of the pod, but also in proximity together. We want them to really just break down any barriers that could exist and think creatively to solve solutions. But in addition to that, we think that those individuals in those pods, or we know that those individuals in those pods start to become the expert on the specific employer benefits that are being offered. So rather than sort of being, a jack of all trades and a master of none, you become the subject matter expert on the plan designs that are offered through Advantage Health Plans. And when someone calls into our customer service call center and speaks to a Kempton Care Advocate, it's one of a couple that support that team. So the chances that that individual has spoken to somebody already are probably pretty good. So you can also minimize the number of times that somebody has to tell their story, which we think is very important.
Absolutely. And that was always a challenge. And we have around 10 individuals that are in our call center now. And you're absolutely right. It was really just haphazard as to who was available when you called. That was how the call routing happened. You just got the next available person. And if you had a real, medical issue that you have been dealing with, and you've had to call in a few times with questions, if you didn't get to that person, we obviously have call tracking and call notes to try to get that next rep that you haven't talked to yet up to speed. But you still had to give the flavor of what you were calling about, and the care advocate would try to get up to speed as quickly as possible. That was historically. In the pod approach, just as Melissa said, you're going to have a much smaller team. As an example, we have 2 dedicated Kempton Care Advocates that don't talk to anybody else but bankers. And so you have a 50-50 shot of getting back to the exact same person. The only reason you wouldn't would be if the other individual was not available at the time. But you can also, we're getting ready to talk about the ability to actually leave a callback ticket through the web portal to have a specific person call you back. So
we want to introduce to you your team members, and you've probably spoken to some of these folks already, but Stephanie Young is in our billing and admin, formerly in our billing and admin department, now part of the customer dedicated pod. Stacy Weekly is one of our Kempton Care Advocates. So the majority of her time during the day is spent on the phone, taking both inbound and then also making outbound phone calls for our members. Tiana Ragsdale. Tiana's new to our team. She actually came on, joined Kempton about 6 months ago, right about the time that we were all starting to go remote due to COVID. But Tiana has hit the ground running. She's one of our other Kempton Care Advocates in tandem with Stacy, and has a lot of experience that she brought to the call center with us. Angela Shoemaker, she's in what we call our research and resolution department. Y'all might not have heard that term before from us, but that department, which is now part of the pod, the individual is now part of the pod. If a member calls in and they've got a question that needs to be looked into a little bit further, if we need a creative solution because maybe a question needs to be passed up to the plan administrator for review, if some medical necessity review needs to occur, so some oversight with maybe our MedCom care management vendor is required, Angela would be involved in some of that. Angela is also being involved in some of the reference-based pricing oversight. And so, making sure that any of the pre-service or post-service advocacy that's happening for any of the members that are on those choice plans, she's sort of overseeing that process and making sure that if a negotiation or a settlement is being requested by the provider, she's working with the plan administrator as well as others to accomplish that. And then Dawn Ward. Dawn is in formerly what we called our plan building department, but there is kind of a double dedicated service that Dawn provides, both not only on the documentation side, so for making sure that things like the summary of benefits or the summary plan description or the SPD, those things align. She works a lot with Corey Cook and the legal counsel who is retained to provide a lot of those services. They work a lot together in making sure that the documentation that is available to the employers and to the members adequately and accurately reflects what the benefits are for Advantage Health plans, and then also actually literally building those plans in our claims adjudication system so that we can make sure that we can process those claims. So if you haven't seen those names before, that is our customer dedicated pod team members. They have been launched for a little while now. We've been seeing a lot of collaboration. We've actually seen a lot of cross training. The launch of this pod has actually resulted in some position changes for some folks, but so far, feedback is positive, but as you know, since we're announcing this publicly, now we have ultimate accountability. So we want to invite you all to give us feedback and tell us how it's working. Okay, so now we want to move into the 2021 changes, and you can go ahead and advance to the next slide if you want. Yep. I'm going to talk about a few things. A proactive approach to our new normal. I've only started recently saying new normal because for about the first 4 months of COVID, I kind of thought to myself that maybe we would go back at some point. But now I guess I'm resigned to the fact, especially given the information that you shared today about the direct and the indirect impact of COVID to the plan, that we sort of had to come up with an approach to address it. And so we have a few things to talk about today, some new consumer-driven benefit options. We're going to talk in more detail about those in the next couple of slides, but we are enhancing and improving some of the drug benefits. So the prescription benefit that you all have historically seen, there are some improvements to that. We're also, I mentioned earlier, going to be improving and enhancing the Healthcare Blue Book Green Rewards program. And I'll show you significantly, yeah, it's a big improvement. So I'll show you what that looks like in a future slide. We are going to be rolling out some additional plan designs. We usually go through that process every year to where, we are not only taking feedback from the market, we're also taking feedback from you. We are analyzing claims data and applying that to how that is, how the plan, level of deductible and copays and all of those things impact all of that. And so we do have a couple of new plan designs that we want to talk about. We are going to talk about a new partnership with a new vendor. So we are always looking for the partners in the industry to help us administer your plan that look, feel, smell, and taste like you do, right? Sure. So, sometimes some of the partnerships and some of the vendor relationships that we have don't allow us to implement the cost containment strategies that we know will have the biggest impact. And so we're always looking with an eye toward due diligence to identify who those partners are in the market, and we've got a change to announce today. And then finally, labeled it common sense plan changes. These are just the plan changes that we talk about every year. We sort of have to go through an evolution with benefits, and so we are going to talk about those. So we understand the cost realities in your bank, and so we want you to know that because this plan is run also by a board of trustees who are bankers, they're always looking for those opportunities to improve, and all of these proactive approaches are in response to making sure that we address those needs. So, Jay, for the next couple of slides, I'm going to hand it off to you to talk about the vendor change in prescription.
Sure. Yeah. So, we're not going to spend very much time on this, but these are just a couple of graphs that I wanted to highlight. obviously medical costs are going up. 2020, that's half a year. But when we look at the health plan claims versus prescription claims, you can see the prescription claims are getting to be a larger and larger component of the overall spend of the plan. When you look over prescription only claims, and since 2015 to 2020, it's increased by $2 million a year. And that's only 6 months of 2020. So, it's going to be significantly higher. When I talk to the folks in our industry and the medical community, the prescription drug costs are really being driven. Drug costs are going up all across the board. But when you look at the segment that's going up the fastest is really the specialty drugs. Sometimes they're called therapeutics or biotechs. They're generally the ones that you don't buy them at a pharmacy. Generally, you'll get them from a specialty pharmacy through the mail. A lot of times they're injectable or auto-injected. Sometimes they may be oral, and we've seen a lot of oral chemos, but these are very advanced therapies. They're really cutting edge, and they're usually there to address really pretty serious medical conditions. But when you look at the number of biotech drugs or specialty drugs, and also some of these drugs that actually have a genetically engineered component to them that assist in the therapy, the pipeline is absolutely full of those drugs. And I mean, every single year we're going to see more and more of those being released. And some of those drugs, I'm assuming you all are sitting down, but we see drugs like that that'll come through there. This $25,000 a month, and the patient's going to take it for the rest of their life. We see some chemo drugs where they're $50,000 a month, but they only have to take them maybe for 6 months. But these are drugs that are, as a nation, we're going to have to really talk about how do we pay for these things. They're miracle drugs, but they also have the ability to bankrupt insurance companies and self-funded plans and everything else. So those are things that are out there. So with that, Melissa said we are making a move. We're going to be moving away from our current PBM, which is Script Care, to a new pharmacy benefit manager known as Southern Scripts. For those of y'all that have consultants, I'm sure your consultants have heard about Southern Scripts. You all may have also heard of Southern Scripts. They're kind of shaking things up. They are a true full pass-through PBM, our pharmacy benefit manager. They're one of the good guys. They make their money, 100% of their revenue comes from a fee that they charge the clients, just a flat per employee per month, which is very unusual for the pharmacy benefit management industry. Most PBMs make their money off of a percentage of the drug or through spread pricing with the pharmacies. There's 1,000 different games that can be played in the pharmacy benefit arena. Southern Scripts is one that they choose to work exclusively for the client. Because of that, when we bring other cost containment ideas like Scripta to the table, which again is a patient engagement, you all have heard and seen a lot about Scripta and the Purple Dot savings reports, where they're trying to make folks aware of higher value drugs, lower costs that are just as effective, et cetera. If your pharmacy benefit manager relies on, as one of their revenue streams, a percentage of the drug cost, or they get a percentage of the revenue through rebates or kickbacks from drug manufacturers, they do not want there to be another vendor out there that is trying to talk patients into buying lower cost drugs. It violates their contracts that they have with some of the manufacturers, which are, those contracts are in direct opposition to what our goal is here. So we're give the patients the best care possible at the best possible price. Southern Scripts doesn't have that, so they work very closely with Scripta They also work very closely with a lot of other pharmacy cost containment companies. Some of them, we're not implementing any of these right now, but they are on our radar. The ability to work with vendors that, for instance, that can source certain specialty drugs from overseas, from other tier 1 countries like the UK or Canada or France. Same exact drug, same exact manufacturer, but a fraction of the cost. Those are things that we wouldn't have been able to do with our current pharmacy benefit manager.
So so some of the changes that we're going to make for the coming year, actually this change we've actually I believe it's already effective. So yes. Some of you may have already seen this. So you're familiar, I think, with the fact that Advantage Health Plans has had a free OTC over-the-counter benefit for a number of years. And so if a participant had, acid reflux or allergies, instead of taking a prescription medication, they could get a prescription orders, that is, from their medical provider for an over-the-counter version. And filling that over-the-counter version through the pharmacy would result in that over-the-counter medicine being covered at 100%. So we are actually expanding that tier of medication to no longer just include over-the-counters, and instead it's going to include some additional medications. And I will not do these medications justice, so I won't even try to pronounce them, but I will just tell you that some of the medications are for cholesterol, rheumatoid arthritis, some inhaled nasal steroids, some eye drops, and then also some laxatives. So sort of the process that we went through was to identify what are the areas. Medications are changing all the time, and medications come into an over-the-counter form from brand medication all the time. And so that analysis was done, and it was determined that adding these medications and even having the plan cover these medications at 100% would probably accomplish two things. One, behavior change, yep. Because like I do, members like free benefits. Yep. And so it would probably accomplish a behavior change, but at the same time also some cost containment from the plan's perspective. So
whether these drugs are over the counter or are other competitive prescription drugs, the bottom line here is if we make the cost to the patient low enough and they were able to make a switch in consultation with their physician to some of these free tier drugs, the alternative drug, the drug that they may be taking today, that's kind of that marquee drug, the price differential between, say, these drugs and the marquee drugs, they're drastic, they're huge, where the plan can actually most definitely afford to give these away for free, yet still save the plan tons of money.
Mm-hmm. The interesting thing about this benefit too is that you might go back and ask your employees, is anybody taking these medications? And you might not have anybody in your organization that says, yes, I am. Well, here's the interesting thing. There might be non-compliance with the medication. Right. Because if a medication was too expensive, then that could potentially be creating a bigger problem down the road. And so there's also something to be said here for adding these medications to the free drug tier, hoping that compliance would be improved as well if historically cost might have been a factor. So
if these drugs are in addition to the drugs that are already on the free OTC tier,
yeah, thank you for saying that. So we've not removed any of the medications from the over-the-counter list, and so any of those allergy or acid reflux medications are also still available, and then this is also, these medications have also been added. Okay. As you all know, several years ago, we also communicated to you that one of the pharmacies, which was Walgreens at the time, one of the pharmacies was actually going to be carved out of the network for the pharmacy benefit manager. And there were a number of reasons for that. We saw little disruption because of it, but also effective January 1st, the trustees have also accepted the recommendation to make Costco no longer a covered pharmacy. Now, there again, a number of reasons for that, part of which is that Costco has actually created their own pharmacy benefit manager. And so as you can imagine, they would be competing for pricing with other pharmacy benefit managers. And so the pricing that Costco gives to health plans that are not part of Costco's pharmacy benefit manager, the pricing that they're giving to plans like us would be higher. And so it would actually be a detriment to the health plan from cost perspective to include Costco. Whereas they're reserving their best pricing for the plans that they are actually overseeing the PBM management.
And actually, I'm sure there's a banker online that said, well, did we look at Costco Health Solutions? Why don't we just move to them as a pharmacy benefit manager? And at least right now, you know, in Oklahoma and Texas and Mexico, Costco just does not have enough stores that provide enough footprint really to make a lot of sense. But that's something that could change. So, you know, I think they're on the list of ones that we could certainly look at in the future. But right now, today, I think we had 7 claimants that had actually had any claims at Costco. It was just almost 0. So this shouldn't be an impact to really anybody out there. And I didn't mention it, you may mention it in a minute, but when we were talking about making the move from pharmacy benefit manager, we're working very, very diligently with them. That'll happen in January 1. But we work very diligently where you're not going to see any disruption out there. And if there will be any disruption, we will make you as a patient know about that. If there is a pharmacy or a drug that there's some sort of change would occur, an individual would be outreached. But Southern Scripts is working very, very closely with us to ensure that this is really a lateral move other than the pricing benefits.
Right. Yeah, thanks for saying that. And disruption is definitely something that the trustees consider when looking at these recommendations. Couple of other plan changes. You all are used to seeing some of these plan changes because every year we have to make sure that Advantage Health Plan stays in compliance with the Affordable Care Act. And so, as you know, we have a couple of plans. We call them the minimum value plans or the MVP plans. Those are the plans that were created several years ago. We call them the check the box plans. Those are the plans that check all the boxes from a compliance perspective, but offer the most affordability to still be compliant with what the requirements of the Affordable Care Act are. So those have the highest deductibles, the higher copays, et cetera, but those also, because they are ACA compliant, they also track the maximum out of pocket, which every year due to inflation increases.
The federal level.
At the federal level. So you all see this change every year, and the maximum out of pocket for those 2 plans as reflected here will be changing effective January 1st. As well, we normally present to you that the qualified high deductible health plans undergo a change. We had anticipated that change would also occur for 2021, but the IRS decided not to increase the minimum out of pocket amounts for the high deductible health plans, and so there's no change to those plans for 2021. The next change is regarding dependent pregnancy. You know, as far back as Advantage Health Plans has probably existed, there has always been a unilateral exclusion for dependent pregnancy claims. So what the change is that's coming January 2021 is that all the plans actually consistent with what the requirements of the Affordable Care Act are will cover any of the preventive services, even for somebody who's got a dependent pregnancy diagnosis at the 100% benefit, just like any other preventive services will be covered. So you kind of ask yourself, you know, what's in a category of preventive services for someone who's pregnant versus a category that is part of maternity services. And there definitely is a line there, but typically from a 60,000-foot view, what I would tell you is that any of the care leading up to the delivery, leading up to the birth of the baby, likely is going to be covered under dependent pregnancy, under the preventive services, even if there's a diagnosis of pregnancy for that dependent. But once the birth or the delivery happens, obviously those would fall into what we would call more of a treatment category, no longer being preventive. So that is a change that is effective January 1st. Skilled nursing, I will tell you just sort of categorically, there have not even been any claims in this category, so this is probably something that is not even on anybody's radar, but again, with always having an eye toward compliance, per the ACA, the skilled nursing benefit will actually be limited to 30 days annually. All of these changes take effect January 1st. We're running through them a little bit fast as we sort of come to the close of our presentation, but just remember that in any of the conversations that Brad and Garrett have with you all as they communicate the renewal and any of these plan changes, we can certainly go into more detail about. Durable medical equipment change is happening January 1st. The current benefit is that replacement DME or durable medical equipment is non-covered. The new benefit is that replacement would be covered. So we kind of use some anecdotes around our office to try to understand and help communicate not only to our own employees, but also to members who contact us, sort of the difference between when something might be covered or when something might not be covered. So the third bullet is very important there, which is that medical necessity review is always required. And durable medical equipment on most of the plans is subject to a deductible and then a co-insurance benefit, which means that whatever plan design that employee is enrolled in, whatever the level of deductible is, the employee would pay those dollars first dollar up until the point that they meet their deductible, and then after that the co-insurance would kick in and the plan would start cost sharing between the plan as well as with the participant. So the anecdote that we like to use, to give an example of what might be covered, what might not be covered due to the medical necessity is, if there's an 8-year-old child, and that 8-year-old child is confined to a wheelchair, but as that 8-year-old child grows, her physical needs change with the growth of her body. And so if a medical necessity review were undertaken to determine whether or not the replacement of a wheelchair were necessary, the medical necessity review would determine that because of the growth of that child, new equipment is necessary or replacement of that equipment is necessary. Yep. She needs a new equipment. So that's sort of a common sense understanding of how that medical necessity is reviewed. In stark contrast to that, if somebody, an adult, as an example, fully grown and has a wheelchair, still confined to a wheelchair, but decides that as a hobby they wanted to take up wheelchair basketball, and so they needed an electric wheelchair to gain an edge on the opponent. When the medical necessity review were determined, it would likely be determined that it was not medically necessary to replace that wheelchair. So those are a little bit extreme, but that's the reason we like to talk about them, is because it helps you to sort of see the logic and the reason behind the benefit changes. So the replacement or the wear of damaged equipment will now have coverage starting effective January 1st, subject to the regular plan benefits, so long as the medical necessity can be determined. The second benefit on that page is for TMJ. So there is a current exclusion for that diagnosis under the plan. However, January 1st, that exclusion is being removed. And so treatment for TMJ services would be covered. The one limitation there is that the coverage must be done with a KPP-free provider. Any other providers would still remain as non-covered. And then finally, this is sort of an extension from a plan change that we communicated to you last year regarding hearing aids testing. The current benefit, well, let me back up. Last year, we actually made a change to allow coverage for hearing and remove the exclusion for any hearing diagnosis. And so it allowed the coverage of having a hearing aid. One of the things that stayed in that plan change, though, was that sensorineural hearing loss was still going to be an excluded diagnosis. So you can see there that the coverage, that the current benefit is that services related to the diagnosis of sensorineural hearing loss are still non-covered, What's changing effective January 1st is that exclusion is being removed. So that exclusion for that particular diagnosis is being removed, and the plan benefit that was allowed last year is actually available across the board. The thing to remember about that plan benefit is that for all services, testing, as well as for the apparatus of the hearing aid, there is a lifetime maximum of $2,500 for each year. So all of these are improvements and enhancements to the plan, all in my view, I perceive positively.
Yep.
The two new plan designs that we are adding this year are both choice plans. So we talked a little bit about reference-based pricing and mentioned that anytime we mention choice plans in the name of the plan designs, those plans actually are full reference-based pricing plans that have gone network replacement, so there is no network. So I think currently we offer 3 plan designs, all 3 of which have about double or more the deductible that you see here shown on the screen. So the plan designs that we're adding this year, we actually perceive as a real benefit because, you know, you have the ability to really contain the cost from the premium contribution perspective, because since they are reference-based pricing plans, we usually see like a 20% differential in premium contribution between these plans that are reference-based pricing and their PPO network counterpart plans. So not only do you achieve the cost containment from the premium contribution perspective, but you also, which is the reason for that cost containment on the premium contribution perspective, you achieve the claims cost containment. So the 2 plans that we're offering, the first is the Choice Select 500 plan. It looks a lot like our Select 500 plan because it's exactly like the Select 500 plan in that it has a $500 deductible. After the deductible's met, then it's an 80-20 coinsurance split, and it has a $15 office visit copay. And then we're also offering the Choice Value 750. So that is modeled after the Value 750 plan in that it has a $750 deductible, a 70-30 coinsurance, which means the plan's going to pay 70%, the member is going to pay 30% until their out-of-pocket is met, and then also a $35 office visit copay. So here's what I would say about these plans and reference-based pricing. We're finding a lot of value in offering the reference-based pricing plans. And as you saw on the earlier slide, we're also not seeing a significant amount of balance billing that's occurring for the members that are choosing to enroll in those plans. But one of the sort of assessments that we've made is that when a member has a higher out-of-pocket, so a $1,500 deductible, a $2,000 deductible, a $3,000 or $3,500 deductible, when the member has a higher out-of-pocket or a higher deductible that the member has to meet, oftentimes it's hard for the member to even meet their portion of those costs.
They're legitimate out-of-pocket.
They're legitimate out-of-pocket. Their patient responsibility according to the benefit plan. And you all know that. I mean, I think the average deductible right now on plan designs that are being offered is $3,500 or $3,000, and it just continues to increase. And so, our hope, our focus, our thought in offering these and developing these plan designs is really twofold. But we wanted to give you at the bank level an opportunity to improve the benefits for those employees, to make it easier for those employees to meet their patient responsibility obligations for their legitimate out-of-pocket cost. But I will tell you that it also has a positive outcome on the other side, because if we get into a negotiation conversation with a medical provider that has decided to balance bill, and like you saw earlier, that's highly unlikely, but if we get to that point, the easier it is for an employee to have met their own deductible patient responsibility, and the more likelihood that they've done that, the easier it is and the better negotiation we have on the back end with that medical provider to try to negotiate a settlement on any portion of the balance bill that has occurred.
It's a great point. And it happens all the time when we're working on those. If the medical procedure is let's say the bill charges $10,000 and the patient has got a $2,500 deductible, which they haven't been able to pay yet. They're working on it. And then they balance bill the patient, and we're talking, the provider is going to say, so you want me to give you a deal and I don't even know if I'm ever going to get paid the whole $2,500, and you're wanting a deal on the other side? No way.
Yeah.
But if you're able to have the conversation with the medical provider, hey, this is a Cadillac plan. This is a great plan. The patient's going to hopefully has already paid their $500 deductible, et cetera. This is a good plan. This is the kind of plans that you would like to see more of, Mr. Hospital, Mr. Doctor's Office. If you are able to give a competitive pricing arrangement, say 170% of Medicare, then these kind of plans can flourish, and you will have eventually you will have less out of pocket to chase.
Yeah.
So it's a very compelling argument.
Yeah, no doubt. So we'll be talking with you more about those plan designs, and we really want to give you guys some encouragement to consider offering those for 2021.
We'll be doing that at Kempton.
We are doing that currently, and
with the 1,000,
we'll be adding a lower deductible
yep.
plan. Okay, we're coming to the end of our presentation, I promise here. So the next several slides are going to go pretty quickly. I prefaced the benefit changes conversation by saying that we were going to have some improvements to our Healthcare Blue Book Green Rewards program. You're going to see on the next 3 slides that show medical procedures. So all the medical procedures that are listed in black on the next 3 slides are all of the medical procedures that are being added to the Green Rewards program. And just as a quick reminder, the Green Rewards program is a program that incentivizes but also rewards, as the name suggests, the member for choosing what we call green providers. So a green provider is a provider, in summary, that is charging a fair price for that medical procedure. Well, what's fair? Healthcare Blue Book is the place that you can use to determine what that fair benchmarking looks like. But the way that program works, or the way that benefit works, is that when the individual chooses to have medical services performed at providers that are charging fair and reasonable costs, that generates a savings for the plan in stark contrast to where they could have gone at another provider that is price gouging the plan, frankly.
Some of those differentials are huge.
Some of the differentials are huge. And so the way this plan, this benefit is sort of designed is that when the plan generates a savings, the plan can reward the member by sharing some of that savings back with the member. And so the plan actually pays a cash back reward. And you can see in the column on the slide that reward can range anywhere from $50 up to $500 that's listed there on the screen. So that's intended to be an incentive, but also a testament to a self-funded plan that's owned by the membership and both taking part, both the member as well as the plan taking part in that savings opportunity. So what are the items that are listed there in blue? The items that are listed there in blue are the procedures that are already part of the Green Reward, and so those are the procedures that would have already been eligible for that benefit. But you will notice that those rewards have actually increased. And then, as I mentioned, the items that are in black are the ones that are being added to that benefit.
Yeah, the only thing that I would add, we're not going to read all of these, but you see some of the rewards are large, and those are for larger dollar procedures that have very large differentials between a low value medical provider that offers it and a high value medical provider that offers it. And then the last thing, I'm sure there's probably some HR folks that are saying, you mean to tell me, what if I use a KPP for, say, a knee replacement, so I have no out-of-pocket costs, am I still going to be able to get my green reward? Yes, you will. So we did not make any of these mutually exclusive. So if somebody goes and has a screening colonoscopy because under the Affordable Care Act, they are over 50 and it's their first one and they can get that paid at 100%, they will get that for free. If they use a KPP, they get it for free. If they don't use a KPP, it'll also be free. But if they use a provider that is also a green provider, which all KPPs are green providers also, then you will actually profit, if you will. It's really a share, it's a shared savings arrangement. But yeah, these are not mutually exclusive. They can double dip, as Melissa said earlier. And trust me, the financial, the dollars and cents work out to where these reward levels are a no-brainer in the plan savings that they generate.
So we went through those pretty fast, but we published them in your packet. And so when you all download the packet, you'll be able to take a look at those. So I think, Jay, that concludes the changes that are happening. So I'll pass it back over to you to talk technology.
Thank you. So yeah, so we're kind of coming to the end here, and these are going to be talked about more as they roll out, and we'll probably be doing webinars on these as well. But effective October 1st, 10/1, we're having a pretty significant upgrade is being done to our member portal. So when you go to advantagedhealthplans.com and you click on the member link and you go and you log in, hopefully everybody has created a member login by now. Effective 10/1, there's going to be within that portal, it's single sign-on. So once you sign in once, you're in. But when you click on the new help center, you're actually going to come in. This is a screenshot of what it's going to look like. If you have a KPP question, you can click on that. There's a knowledge base behind each one of those topics where basically frequently asked questions are going to be there, and those are going to be updated dynamically on the fly as we get more. Somebody asks a question, and my gosh, we've gotten 5 of those this week. Very likely we'll make it into the frequently asked questions section. In addition to that, when a member elects that they need help, okay, I've read the FAQs, but I still need help. Obviously, you can still call us if you would like, but this is going to give you a new avenue to reach us, because within each one of these areas, you can actually create your own inquiry, which gets automatically translated into a ticket. It'll have a ticket number that will be shared with the patient. Then that comes to our customer service area, the AHP pod, where they then, that ticket will be addressed by one of the care advocates or one of the research and resolution people. When you come back to the help center, you will be able to review your tickets, see where your tickets are at. Have they been looked at yet? Are they in process? Have they been cleared out? So it's 100% secure and confidential. You can also specify your preferred contact method. If we need to get back to you, we can either get back to you via electronic or we can get back to you via phone. That's really it. That we're super excited about this, though. We've been actually utilizing this ticketing system for almost a year now. And this is basically just giving the members an avenue to be able to access our ticketing system for their benefit as well. So that is this is the member help center that is on the AHP portal. Another enhancement that's coming out that's no cost as well to the bank or to the member is a new mobile app for KPP Free. Melissa alluded to it earlier. One of the things that we've always thought about and we've heard about since KPP was invented and we started doing the voucher system, once you had your procedure scheduled in and you're just about to go in for your procedure, then we provide the member with a voucher. We've always said it's like a boarding pass to get on an airplane. You present it to the premier provider. They know where to send the claim. They know not to charge you any out of pocket, et cetera. But we've also said, well, if it's like a boarding pass to get on an airplane, I don't carry a lot of paper boarding passes these days. I use my phone. You use your phone. And so the new KPP Free mobile app is actually going to give the members the ability to, they still have to coordinate it through the care advocate, but when it's time, once it's all been coordinated, it's time that you get your voucher, you will actually be able to retrieve your voucher through this mobile app, present this mobile voucher through your iPhone or Android to the Kempton Premier provider, and they will use that in lieu of the paper voucher. In addition, you will also be able to keep track of and view any upcoming appointments that you would have with a KPP. You can request a new procedure or search for KPPs in your area, and also search for qualified procedures. Is the surgery center that's in my town, I wonder if they offer ankle surgery for me. I don't know if that's a KPP approved procedure. I can now check on it at midnight on a Sunday evening. So that is all, that'll be going live actually as soon as we get the communications out. It's actually live right now. If you wanted to go out and download it, you could actually use it today. The way that you get it in the App Store, either the Android market or the iPhone App Store, is you need to search for Coral Healthcare. Make sure you add healthcare to the search. If you just choose to search Coral, you will get a result that is not affiliated with Advanced Health Plans nor the Kempton Group. Let me just leave it at that. Search Coral Healthcare, and then you'll be able to download the app. Then you choose to sign up and create your user account. This is what is used to keep your phone and your content that is in the app secure. And so this is a different login than what you would have necessarily on our portal. They do not cross talk to each other. The signing up is very easy. You click on sign up. You're going to enter the last 4 digits of your social security number or your member ID, which is on the back of your hospital ID card, your last name and your date of birth. And that is really it. And then you are now in, and you can also communicate with the care advocate through the mobile app. That was about as fast as I could get through the technology.
You did a good job. All right, so now here's
second to last slide.
Second to last slide. Now here is what we need from you. This is our call to action, what's going to happen next, and sort of how to get us through the end of the year. So first of all, I think I mentioned earlier, I'll do it again here, that Brad and Garrett have a goal to contact each of you starting today, probably over the next week, and to let you know what your actual bank's individual renewal rate adjustment is going to look like based on, you know, what we call the risk categories or the bucket shifts. So look for their call. Secondly, we are asking that you consider heavily looking at some of the new choice plan designs or the other choice plan designs, and we can show you what those look like from a premium contribution perspective. We can go over in more detail what the benefits are. We've even got references from other banks who've been offering those plans for a couple of years since they came out, if you're interested in talking to someone who's doing it currently. Although we're in COVID and we're going to be very respectful to what everybody's own organizational, you know, response plan is to that, we are asking that you schedule an employee meeting, an education meeting between now and the end of the year. You'll do that with Brad and Garrett. That can take on a lot of different forms. We've done everything from an on-site meeting, which we have actually lifted our travel ban. Some of you know that we were actually in a travel ban earlier this year due to COVID, but we've lifted the travel ban. So, you know, we want to be respectful for what your plan is, but if you're interested in having somebody come out and do an employee meeting on site with you, we're available to do that. We can also do it remotely, just like we're doing this presentation, and we'll also have some recorded versions that you can sort of play on demand. But we would like everybody to place an importance on scheduling an employee meeting and an education meeting between now and the end of the year, because we, like you, think that's important. We are asking that if you haven't already, if there's a way that you at the organization level have access to, maybe you would call it a census, maybe you would look at you know, some type of a download from your payroll system, maybe some type of a download from any other employee management system. If you've got email addresses and mobile phone numbers, if you can provide those to us, we would love to have those. That can help to improve communication whenever we're pushing plan changes and communications, and also reminders for education out to the membership. But also some of the outreach that we are going to be doing over the next year is customized for an individual. You've seen a little taste of that because you've seen the scripted engagement with scripted insights, where, you know, an employee might receive a text message that they're taking a medication that if they switched it could, you know, could save them money. So some of that is already happening, but we want to improve those efforts. And so having mobile phone numbers for individuals is very helpful.
And we will not ever sell any of the contact information.
Yeah, sure. Thank you for saying that. The only purpose for using that is to push out plan changes and to accomplish greater redirection. Please know that with the pharmacy benefit manager change, the PBM change to Southern Scripts, that will necessitate a reprinting of all of the ID cards, which will be forthcoming. So be on the lookout for those, and make sure that the announcements are going to your employees, you know, to replace the old one with the new one. I just thought about this, it'll also have the new logo on it. So yeah, those will look really nice.
It'll be easy to identify.
It'll be easy to identify. This goes without saying, but adopt a culture of consumerism and cost containment in your organization. You know, we want to be there to support you, and if you need ideas about other things that you can do to facilitate that cultural adaptation, you know, having an eye towards cost containment, we'd love to talk to you about what others are doing in the space. But we also think that, you know, having a meeting once a year can only accomplish so much. And so we want to sort of help the evolution of that culture of consumerism to be adopted within your bank.
And banks, I might add, you know, banks that do adopt, and where it becomes a management requirement, it's a management topic within the bank, where the CEO stands up and says, hey, this is what we're going to do. You need to pay attention to this. When that happens, obviously the engagement is better, but those banks perform better within advanced health plans. There are so many mechanisms that are there that with behavior modification, the cost can come down, and thereby your you know, if the more banks that do that, that trust level increase doesn't have to be 10.6, it can be 5, it can be 0.
Yeah, no doubt. You're going to be getting a lot of education materials from us. So there are things like the summary of benefits and coverage, or the SBC, the summary plan description, you know, even just flyers, videos. Typically, we share those at the employer level. So whoever our contact is that's either designated as the attorney in fact, or another benefits committee member within our organization, typically we're going to send that information to that person at the employer, and then we ask that that sort of be disseminated down through the organization. So be on the lookout for those. A lot of that information is also accessible through the employer portal or publicly on our website. So, you know, if you're having a staff meeting on a quarterly or a monthly basis, and you think just, you know, having some information to just sort of keep that at the front of mind would be helpful, which we think it is, there's just a ton of resources and materials available. If you're just not sure where to go, we also know that there's a lot of information. So give Brad a call, give Garrett a call, and let them sort of hear what your expectations are, and what you're wanting to accomplish, and what the venue is that you're wanting to share the information, in what format, and let us talk you through kind of where that information might live in our world. We access it every day, and so we can definitely help you with that. Also, adopt a Go for Green strategy. That sort of goes along with the cultural engagement, and then promote and encourage the KPP-free utilization within your own organization. Now, one other announcement that we do need to make is that open enrollment is getting ready to start. And so during the period of open enrollment, you know that your employees can submit changes that, you know, you might decide as an employer to offer a different plan design to the employees, but the employees can also choose to enroll or disenroll and add or drop dependents during that time. Typically, the time for open enrollment is October 15th to December 15th. And so we ask for all changes to be into our organization by December 15th, and that gives us the ability to process those changes and make sure that everybody's effective and can fill their prescriptions on January 1st. That's usually the thing that happens January 1st is everybody goes to refill prescriptions. So historically, open enrollment has ended on December 15th. At the last trustees meeting, the trustees actually accepted a recommendation from the plan administrator to change the open enrollment to ending on December 1st. So take note of that change. We'll be communicating that out in a number of different ways. I think, you know, we're going to be including that in the renewal letter that goes out. We're going to be including that on the website for those employers and for those individuals that have access to the employer portal. You ought to see a splash screen there. We're looking for every opportunity to communicate and get that message out, but take note of that and also be sure to communicate that to your employees because that is the period of time that they're allowed to make those changes.
Yeah, and the recommendation to you know, back that up by 2 weeks was certainly not taken lightly, and it certainly wasn't intended to be a takeaway for the member banks. It was simply an effort. I'll just tell it to you real here. Given 15 days to be able to get all the changes in and then make those changes and then create new ID cards, has been very, very difficult for us to be able to hit that benchmark. And we hate it when January 1 rolls around and we have banks and members that do not have new ID cards yet. And that happened last year. And so we don't want that to happen again. And so that's why we're moving that back by the 15 days. And we appreciate, I think you all can appreciate the need to be able to do that so we can make sure that we have time to orderly review the changes, quality check them, get the ID cards to the vendor, and get those things also taken into account the U.S. Postal Service, which is a whole other topic. But, we hope they get there at all, but hopefully this will assist in getting those there prior to January 1 with some room to spare. Okay, last slide. This is just really a reminder. The Advanced Health Plans Trust legal update with the new trust counsel, Corey Cook, will be presented October 28th. It's a separate, we just felt like this meeting it's just so cram-packed with stuff that we just didn't think we could do justice and also keep you all, you know, from jumping off a bridge or slitting your wrists. So we decided to go ahead and break out the legal update to another time. So October 28th from 12 o'clock noon to 1:30 p.m. Myself and Corey Cook will be there. You can register at advantagedhealthplans.com. This will be really kind of a soup to nuts legal review. Corey is also looking at and has the potential of refining some of the really some of the responsibility balancing between Advanced Health Plans Trust and the member banks with an eye towards making it more straightforward, easier to navigate, et cetera. So it certainly would behoove everybody to attend, especially the folks that are involved in the administration of the health plan at the individual banks. And with that, we conclude our regularly scheduled presentation here. I'm going to go ahead and open the question menu for us so we can see what we have here. So let's see if I can clear out some of the old questions. All right, that's looks like
okay, so yep. So first question, and everybody, if you've got questions, be sure and put them in your chat box and send them to us because we can see them. Will there be virtual or in-person renewal meetings this year? So we are available for both. We will not only be contacting the employer to deliver the renewal, you'll receive the renewal in paper. You'll also receive it virtually because it'll be available on the employer member portal. And then our focus will be on scheduling those employee educational meetings. And we can do that in one of three ways: on site, where either Brad or Garrett or somebody else comes out to your location to actually facilitate those meetings live. We can also do those by webinar in a format that's very similar to this, where we're live, but you're seeing us on video and audio. And then finally, we've got some recorded options. We shared some of those with you last year. We will be refreshing those and can share them again, and those are sort of available on demand. Next question, will the website be updated so I can manage employees? So regarding enrollment changes and those types of things. So yeah, great question. Enrollment is, from an open enrollment perspective, we'll actually be delivering some information to everybody on what those actual instructions are, probably in the next week or so, maybe 2 weeks or so. But certainly prior to open enrollment actually opening, we will be getting instructions out to everybody on how we will go through that process this year. So appreciate that question, and we'll make sure that you all have those instructions.
Tell you, one of the things we have learned is it is a potpourri as to when you've seen one community bank and how they do this, what they prefer, you've seen one community bank. So we are still working that out, and we will certainly communicate with everybody on that soon.
And then the final note here, which is not a question, it's a comment, but we certainly appreciate it, is this is great. So we agree.
We appreciate everybody's attendance, and it's kind of difficult since we can't see if everybody's asleep or still with us. It looks like most everybody is still with us. But if there's no more questions, we'll go ahead and end the webinar and let everybody get back to their day. I hope everybody stays safe, and we hope to be able to serve you soon, either in person in the bank or with open enrollments. So
thank you all.
Thank you all.